Adeva. I'm 54 years old. I'm working as a Senior Director for Facilities and Property Management in a BPO company. So this is my second time here at CSA. So I had, during my first visit, I had this DERM treatment, which works for tightening, clearing, and lifting of the face. And I'm looking forward for the second session, which is scheduled today for a more beautiful me. Please don't forget to click and subscribe and turn on the notification button. Thank you.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a new guest. Let's all welcome Ma'am Lyra Adeva.
Hi, good morning. I'm Lyra Adeva. I'm 54 years old.
Okay. Ma'am Lyra, hindi tayo nagkakalayo. I'm 51.
But you look a lot younger than me,
Thanks to
Doc.
science, okay? That's why we are here, Ma'am Lyra. It's really to, improve our looks and make us look younger, okay?
Yeah, I agree.
And thanks to technology right now, we have this science that's able to rejuvenate us and bring back our looks when we were in our, what do you want to achieve, 20s?
20s? No, that's too much.
Or
30s
10 years
will do.
younger, something like that. Okay, but I believe 50 is the new what?
It's the new 40.
They're also saying 60 is the new 40.
40,
Anyway,
okay.
so we want to do a treatment for Ma'am Lyra, of course, that will improve the skin quality, the skin texture, and will target the fine lines, the wrinkles, and also some of the age spots, no? Or sunspots, or some of the dark spots, and at the same time, close the pores or tighten the pores and induce collagen stimulation, okay? And Ma'am Lyra is always busy, right? At work.
Yes,
She doesn't want any procedure that has a very long downtime. As much as possible, minimal downtime, okay? And she wants natural results only, that we still recognize her, okay?
Yes.
So we're into these non-surgical procedures right now, okay? And if we assess Ma'am Lyra, okay? So in the past, we've done some treatments for Ma'am Lyra already, okay? Actually, we did one session of an RF microneedling. We did some toxin injections to relax our muscles on the upper third of the face. And we did also some thread lifting in the past, right? And Ma'am Lyra looks how many years younger? Okay.
I look prettier now.
Yeah. When we do treatments that are non-surgical and something to, rejuvenate us, we have treatments that are done in sessions, okay? Because like aging is a continuous process. Like every day we age, okay? There's a certain percentage whereby our skin proteins, they just denature each day. But the good thing is, these proteins, they also regenerate or they renature, they reform again with the help of science, of course. Kasi when we're aging daw, nag-slow down na yung regeneration ng tissues natin. As we get older, the longer the tissue turnover. If your skin cells, they like exfoliate in a month, the older we get, kung 50 years old na tayo, parang 50 days din nag-change yung skin cells natin. So we wanted to do a treatment that will somehow bring back that original state of our skin cells to sustain younger skin cells, and also like do a skin resurfacing, so go away with the old cells, bring out the baby cells, the new cells, okay? So that's something like we want to achieve. Na non-surgical, of course, minimally invasive or non-invasive, and no downtime as much as possible, and we're afraid of like complications or any risks. So we want a treatment for Ma'am Lyra that will just make us 10 years younger and natural looking. So what kind of treatment? What procedure? We'll show you when CSA Medical Aesthetics return. And we're back. So we're still with Ma'am Lyra. And together with us, we have Dr. Maureen from Cebu. Hi, Doctora.
Hello.
welcome. Welcome to our CSA channel. Okay, so Ma'am Lira here, as per assessment, if you look at the upper third of the face, we're seeing some static lines there on the forehead, also on the lateral canthal area or the profit area, and infraorbital area also. You can see those static lines, fine lines there, right, Ma'am Lira? And of course, as time passes by, you also see some sagginess on the upper eyelid. So we have loose skin here. And then if we go into the mid-face section, so the cheek area also, we have the so-called ptosis or sagginess. Okay, we're also seeing some mid-cheek groove there, and we're also seeing some nasolabial fold there. And if you notice, Ma'am Lira also has these pigmentations in the cheek area, which is also common amongst women. You know, hormonal aspect from chloasma to melasma, and even ultraviolet sun exposure. Okay. And then on the lower third, if you're going to assess, so we also have the so-called jowling, and the others beginning marionette fold, and downturning of the oral commissures, and the loss of the definition of the jawline. And then if you go at the neck, skin laxity there, and the others have the so-called platysma bands. So the platysma muscles also weakening over time. So, and also some neck lines, neck wrinkles. So basically, those are the things that we see whenever we do treatment for, like, of course, anti-aging, right, Ma'am Lira? Because whether we like it or not, we age, right? And we were discussing, why are we still aging, which we don't really like, okay? But of course, so since this is what's happening, it's a physiologic process, okay? We can do something about those you know, aging processes, like the deterioration of the skin, whereby you lose collagen, you lose elastin, and even the glycosaminoglycans, we lose all of those. The fibroblast cells becoming senescent or like inactive, they don't synthesize new protein connective tissue matrix already. And then the descent of those soft tissues, diba? Everything goes down, okay? And also the so-called volume loss or depletion, okay? So some parts of our face, they get this soft tissue volume loss. For example, so mid-cheek groove or temple volume loss, or even in the forehead, we notice like interior forehead, like sunken areas there, or sunken under eye, or this deep nasolabial fold here. So those are the aging process, okay? So we see those signs, no, Ma'am Lira? Yeah. Unfortunately, we see those signs. That's a sad thing, okay? So these are indications for a specific treatment that we want to introduce now, okay? And you've already seen this in the past, right? We have the so-called RF microneedling device. We have here our new device, the DERM, okay? And actually, this is a painless type of your RF microneedling, okay? So we had other RF microneedling devices in the past, whereby we have those micro pins, okay? And they will pierce your skin tissues, and there's actually a discomfort there. You feel all those micro pins, okay? But with this device, because it has a cooling gas, a cryo gas that will instantly numb the upper layer of the skin. It will anesthetize instantly the epidermal layer, and it emits a certain temperature, radio frequency. Okay? We have heard of radio frequency treatments, okay? They deliver a certain heat, okay? But it has to deliver an optimal temperature. They were saying like around 45 to 65 degrees Celsius to really induce a very effective collagen formation, okay? Because you're trying to regenerate tissues there. And if you want to achieve a very good result, you have to deliver that optimal temperature. Because yung mga ibang RF, they only deliver suboptimal temperature. So, hindi talaga na-achieve yung collagen synthesis. So, we want to achieve that effective thermal coagulation. And with this device, we can deliver that. Kasi the upper layer, it will be like anesthetized or numb with the cooling gas. And then it's going to deliver it into the dermis. The dermis is where you have your fibroblasts, where you have synthesis of your new collagen tissue matrix. So, meron kang fibroblast doon, and it will synthesize yung mga collagen, elastin, glycosaminoglycans for a younger face. Yun yung gusto natin i-achieve, ma'am. Right? Yeah. So, I have my DERM here. It's a pulse RFMN. We call it RFMN. So, it has this GUI. We call this GUI, okay? So, mga push button lang to. And this is the handpiece that we use, okay? Ma'am Lira already tried it in the past, and she really explained to me it's totally painless, right? And she was also saying 0 downtime, okay?
Yes.
So for this one, our goal for Ma'am Lira is full face rejuvenation, okay? We want to treat yung mga fine lines, wrinkles, skin laxity, collagen loss, okay? And also like give that skin tightening, firming, and lifting effect. So improving overall skin quality. Excited, no? So this is an easy to use device. Okay, we have the handpiece here. Okay, so this one has this kind of a needle tip here. So this one is a single use for every patient. Okay, so this is a sterile one, a new one. And then here we have the instructions to follow here. We have different parameters to follow here. So for here, we can start with, so you can see the energy, what is the depth of your needle, and then the duration, yung pulse duration that they call it. And then we'll just do the procedure. Just press this one. So actually, it has a vacuuming effect here, the suctioning effect. This is the cooling gas and the duration of the spray of the cooling gas. Okay. So we'll start with the forehead region, okay? So this is now my handpiece. So I'm just gonna be placing it on top of the skin. And then this one is a silent type. And then just press on the push button here. Okay, so you see the green color, the green light, means to say you're ready to insert, ready to use. And then when you press on it, and then you see also like a blue light actually, whereby the needles are already inserting into the dermis of the skin, okay? Lang, Ma'am Lira. So it's an easy to perform procedure. So we have a power here which is 10 watts, and my depth for my microneedle is 1 millimeter on the forehead region. So you're hearing like a spurt of your cryo gas. That one is numbing the skin. You don't feel anything, Ma'am? No, okay, excellent. So this is easy to use, okay? So we can do the other side. So this is a first pass treatment. So we just proceed with doing this and full face treatment even up to upper neck area. Second pass will work on the mid-face, okay? So mid-face area here. And yun naman may cursor, okay? Okay lang po. Okay, so we did actually 2 passes. The first pass is all over the face, and the second pass is targeting the mid-face section, whereby we want to improve the laxity of the skin plus some of the lines, infraorbital lines that we see there, and some of the sagginess there. So we'll show the result to Ma'am Lira when CSA Medical Aesthetics return. And we're back. So, we'll show the face of Ma'am Lira to her right now. Okay, so we did the RF microneedling, a device whereby we wanted to treat also our, lines, wrinkles, and some open pores, and even some pigments there, and the skin laxity. And we want to improve the quality of the skin here. So, this is the so-called painless radio frequency microneedling. And actually, Doctora, kasi you were asking a while ago, can we also use it for those with PIH or melanin or darker skin color? Okay, or the Fitzpatrick types 4, 5, 6. The thing with the radio frequency microneedling, actually it's not a laser, because laser is chromophore dependent, or they are like, when it comes to darker skin type with laser, you have a higher risk for PIH. But this is RF microneedling, it's chromophore independent, meaning to say it can be used for all skin types or any color. Okay, so colorblind. This device is colorblind, so it cannot lead to a side effect of that burning or PIH or post-inflammatory hyperpigmentation. And the good thing, Ma'am Lyra, it also has that cryogas, that cooling spray on the epidermis, whereby it also reduces the risks for burning. Okay, di ba, Ma'am, you felt the cold temperature, and it's only in the superficial layer. Because the target of the RF energy is in the dermis. So you target the papillary dermis, the reticular dermis, for you to induce neocollagenesis and neoelastogenesis. So it has really, you know, a lot of advantages as compared to other RF microneedling devices. Plus, it has the so-called dual frequency. They say that it has the 1 megahertz and the 2 megahertz. Kasi the 1 megahertz, you can target shallow problems, fine lines in the superficial layer, and it has a wider area of target. When you use the other one, the 2 megahertz frequency, it can target deeper structures, but it's confined in those structures only. So, narrower yung target niya. Plus, we can treat yung mga deeper wrinkles, deeper lines, and even acne scars, deep acne scars. And we can even use this device for our younger patients with acne problems. Those who have active acne lesions, the radio frequency can just zap those active acne lesions. Because the other devices that we use for acne scars, like ablative fractional lasers, right? If you have active acne lesions, that's a contraindication. For like, for example, CO2 fractional laser, and you have a risk of PIH. Those were the problems with the ablative fractional CO2 lasers. Asian type of skin, we're prone to pigmentation, PIH. So right now, the RF microneedling is a very good alternative to your CO2 fractional laser, even if you have the active acne lesions. And it's also like the heat there can zap those microbe, the Cutibacterium acne. Okay? It can coagulate those active acne lesions. So there's a good, like, you know, a device that we can already use for our younger patients na may problem ng acne, active acne, at the same time acne scars. Pero we still have older patients na may acne pa rin. The oldest patient I had na active acne, 64 years old. Pero naka-ano kasi, injection ng testosterone hormone. Kasi 'di ba, the acne is also like hormonal component also, like especially the androgen hormone. Then we can use it for stretch marks and all types of scars, or post-traumatic scar, post-surgery scar. Okay, ano pa bang mga scars? Chickenpox scars. Yan. Or yung may mga large pores. Yan. And overall, talagang younger, youthful skin. And if you wanna achieve that glass skin, flawless skin, spotless skin, it's improving the overall skin quality. Kasi nga, they reported that having that homogeneous skin, flawless skin, or very even-toned, diba yan? Skin tone, skin texture is very good quality of the skin tone. They reported that it has that influence on the perception of attractiveness. Kung talagang flawless, kagaya ni Dr. Marie. Flawless skin.
Ka talaga.
Yan. No, like, skin imperfections, no dark spots, di ba? Talagang smooth, clear, blemish-free, acne-free, scar-free, wrinkle-free skin. Yan. The overall attractiveness daw. And youthful and confidently beautiful. Having that, clear skin, okay na, no? There you go, Ma'am Lyra. Thank you so much.
Thank you,
For
Doc.
now, it's expected to have erythema or redness. That's actually an endpoint whenever we're doing this treatment. And we have applied a soothing gel Then we'll also apply skin boosters. Then we'll also do the low-level light therapy or heat light for the redness to instantly go away. And then after that, we'll also apply a modeling mask, a soothing mask, so that later on, Ma'am Lirang, if she still has a work or anything to do, or she can party tonight, okay? And definitely, you have to apply your sun protection cream, okay? So every day, we recommend sun protection, okay? And then some mild face moisturizer and any soothing cream or soothing gel. That's it, okay? And then usually, we do this in sessions. For full face rejuvenation, you can get 3 sessions or even 5 sessions. Or you can do a maintenance of this one like once a month, once in 3 months to really prevent aging. Okay? Prevention then and rejuvenation. Thank you so much, Dr. Maureen.
Thank you, Doc. Thank you,
Ma'am Mira,
CSA.
meron ka bang social media that they can follow you? If ever, or ask questions?
Just my Facebook account. Yeah,
Lira
Lira
D.
Herbacio.
Yan. Just to
Yeah.
check on how well she improved. And we'll still show some pictures, okay? Like a week later, 2 weeks later, regarding the improvement of the skin quality, skin texture. So, Dr. Maureen, social media.
Maureen Villarreal, Instagram.
Follow her. Okay. And you can also follow us at our Instagram, CSA Medical Aesthetics. Also, our Facebook, CSA Medical Aesthetics. If you have any questions, you may email us at our email address, csaskinclinic@yahoo.com, okay? And also, please watch our other videos at our YouTube channel, Contessa Salvador. And of course, we would like to thank all our subscribers. And please continue to watch all our updates. Yan. And our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9190 or 0917-504-4268. So thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.